Hi, everyone. My name is Jackie Kwan, CEO of our company, Lively. This is my lovely wife and co-founder, Hera Moon. This is a picture of us in 2013, our wedding picture. But shortly after we took this picture, Hera actually had a cancer scare where she went through months and months of diagnostics, imaging, bouncing from one specialist to another. It was horrible. In the end, everything's okay. But when all your interaction with your specialist, with your physician, is squeezed into these 15-minute appointments, tons of communication is lost. This experience gave birth to our venture, Lively. Lively is a easy-to-use, secure messenger for doctors, patients, and your loved ones, regardless of what hospital you're in, what insurance you have. One secure platform where everyone can collaborate effectively. The $25,000 from tonight will be used towards additional user testing as well as our app development. The problem we're trying to solve is healthcare communication, which is tremendously inefficient. Our healthcare system relies on a combination of pagers, fax machines, calls, handwritten notes, and you name it. And this poor communication in healthcare amounts to $50 billion in waste. To give you an idea of how bad things are, over 60% of American physicians still rely on fax as their primary form of communication. But it doesn't have to be this way. In Brazil, over 80% of physicians already instant message their patients. And same story for countries like the Netherlands and Italy. Lives have been saved. Just picture this. Imagine if I take your smartphone and remove all the messenger apps and give you a fax machine instead. What would your life be like? Healthcare messaging is a $1 billion market growing at 17% a year. There are other platforms that are out there, but a lot of times they do not facilitate communication between different vendors. And in the rare cases where connections need to be linked between different vendors, tons of man hours are spent to consolidate the different protocols. And that's why we thought, what if we don't look at this as an engineering problem? We look at this as a design problem. After all, design is what makes people use things. So instead of doing things the old way, why don't we let physicians use their smartphone cameras and transfer medical files this way? The same way you would deposit a check using your banking app. And we're working with our lawyer to file a provisional patent, and we're also working on additional design where we can facilitate transfer of medical files in similar ways. Lively is built with the complex patient in mind. These are instances where multiple specialties are involved, and primary care is perfectly positioned to serve as the hub of the wheel. Lively is built on the same secure platform used by the Department of Veterans Affairs, as well as Blue Shield of California. Using QR codes, you can add your physician the same way you would connect with your coworkers on LinkedIn. And extensive use of API allows for effortless integration. In this screen of our prototype, the Doximity API is being used to authenticate a doctor's identity. Chat rooms are organized to balance empathy and privacy. And an open platform means that services can reach people who need them the most, from telemedicine to diabetes management. Imagine all your healthcare app in just one place. Lively this is an obviously classic example of two-sided market. You have patient on one side, you have physicians on another. So how do you bring everyone together? Easy, by giving them incentives to be on the platform. For patients, the Lively platform will be free of charge, giving them the ability to consolidate all their medical files, as well as crowdsource support from their own community. For doctors, we're targeting one of the biggest pain points of their lives. Doctors did not go to med school to play phone tag. And the basic version will be free of charge with additional services available for $7 to $15 a month subscription. And once we hit critical mass, we will introduce third-party services where we can improve the patient-doctor experience. This will also be a much more reliable revenue stream. Now you may ask, how is Lively different from all the other healthcare messengers out there? True, most hospitals have their own patient portals. Most doctors have ways of messaging each other. There are even apps that facilitate communication between doctors and patients. But healthcare does not revolve around one single hospital or one single insurance. Healthcare revolves around the patient. And that's why Lively is different. In this day and age where people switch insurance companies every few years, where nobody goes to just one hospital for the rest of their lives, primary care is the one relationship where people would still see the same doctor, same PCP for 20, 30 years. And that's why Lively is different. Our team is obviously a husband and wife team. Hera is getting her master's in data science at Berkeley. And prior to Berkeley, she was helping companies with their most complicated healthcare and pension problems around the globe. She's also a painter, so she handles actually all things design you see today. As for me, I am a healthcare actuary and a healthcare consultant. For the last decade, I've been helping insurance companies, hospitals, and government agencies with their most complicated problems, ranging from technology to operation. Our plan is to use the InciteHealth funding and bootstrap for the first 12 months. Down the road, we see our most likely exit opportunity because we hold patent as well as the fact that most value can only capture down the road to be acquisition where we integrate it into services. The vision of Lively is to improve the doctor-patient experience, letting you focus on what matters the most. If you'd like to learn more, follow us at Yes to Lively on Twitter. Thank you very much.
Back over how you're going to go to market. So I know you're kind of building the prototype and getting things, but just what's in your mind?
Sure.
What complex patient do you go after first? What vendors do you go after first? Stuff like that.
Yeah, so maybe I can break that down into the patient and the doctor. For the patient side, we are targeting communities where we're speaking with one particular community. It's a rare disease community. Rare disease, but still 1,700 members in that particular community. On the provider side, on the doctor side, we're targeting small physician clinics. So instead of a big, like for example, Kaiser Permanente, they've spent $1 billion building their capability and infrastructure. We're targeting actually the small clinics, the small providers, up to maybe 10 members, and I think that's where we can serve as we can provide the most help as early adopters.
So what do you think is like the total addressable market here for this? When you think about like, you know, the subscription, it's like $100 a year per physician. You know, are there enough physicians that would use this to actually, you know, generate a return on the value?
Yeah, we were debating on the pricing too, and the pricing we can actually. I'm an actuary and I do a lot of financial planning. I can structure this where down the road we're talking about maybe $10,000 a month in income, but the conclusion that we've reached that we need to think bigger, and that's why we are actually only adding the subscription service as a add-on. So the initial phase will still be free. There will be basic service available for free. With the $1 billion is the entire market, we think a percentage of that could be targeted.
Thanks so much, Lively. Wonderful.
Thank you. Thank you, everyone.